So addressed some of the failures of capitation from 15 years ago, some of the concerns around, you don't want to provide incentives to give people less care than they need. So what's really different about this model is including a requirement, that we have quality goals and targets and benchmarks and measures as a critical core component of this system, so that the delivery system does well when it meets all those goals and targets. So a lot of folks are really looking at this Commission's recommendations, looking at the kind of progress that Massachusetts is making in this direction, and I think we've seen some of that in the National Reform Bill. So I'm not going to talk about this in any detail, but these are just some of the components of the recommendations. This really gets at how this is not, it's a little bit back to the future, but how it's different, how it's better, how we looked head on at some of the criticisms of capitation and made recommendations to improve and address them. I'm happy to talk more about this later. I'm going to skip this. So there were many other components of this healthcare cost containment bill back from 2008, including new investments in health IT. Since this happened, even before health reform at the national level, thank you to the stimulus package, we have huge investments coming down to the states and opportunities to get more funds to really advance information technology support in states. Much more public reporting around hospital-acquired infections and serious reportable events and transparency around that. New regulations around pharmaceutical and medical device, and panels around end-of-life care that have made recommendations there. Work on administrative simplification, some progress on the scope of service side. So we now, as a result of this bill, have more nurse practitioners who can work under the supervision of physicians than we had before this bill. So some progress. And our state continues to prioritize cost containment. So we've got the Division of Insurance conducting hearings talking about premium growth and why are premiums growing so fast. The governor's filed legislation. This is actually kind of written not entirely accurately, but has issued emergency regulations to cap the growth in premiums immediately, perhaps starting as soon as April 1st. That would potentially say that in our small group and non-group market, which is a huge market in Massachusetts, that potentially premiums may be constrained to not grow more than about 5%. So we'll see where that all shakes out over the coming weeks. And then filed a bill to actually also cap in that same part of the market the growth in provider rates. So we're having a pretty active conversation in this state. Attorney General just released a report that has really shined a bright spotlight on the differences in the way providers are paid. Big issue here. I expect that if we had the same level of transparency in other states, we'd see the same variation in rates. But a big conclusion was just looking at the impact of market power on rates in the state. And I already talked about the hearings. So there's a lot going on right now. But I do think as we look at where consensus seems to be building, while we're having I think one of the tensions is what can you do in the near term to really get a handle on cost growth? I do think that we're seeing consensus at the local and national level that moving forward with payment reform, with changing the way we pay, is really a critical component to getting a handle on long-term growth in health spending. There are clearly other things we need to do, comparative effectiveness research and other things, but I think we're seeing this to being a major feature. So more questions ahead, as I said, both in Massachusetts and I think at the national level. I think a real tension right now about what we can rely on the private market. We have a deregulated system. Prices, with the exception of Medicare and Medicaid, are all really the function of negotiations between private insurance companies and providers. But we're having a conversation now about whether that's the right path, and the path that will be on moving forward in this state. Thinking about what do we need to do to get a handle on this in the near term, and particularly hearing a lot of concern from small employers about the impact that this growth in healthcare costs is having on their businesses in this economy. So what short-term options we might be able to pursue versus those longer-term solutions, and I would put kind of the conversations about payment reform and comparative effectiveness and those other things in the long-term bucket. And so National reform, I think, again, has some great opportunities for states to pursue pilots and demonstrations. There are incredible investments in public health. There's, after about a year, about $1 billion that's going to be invested at the federal level that will flow down to states to make significant additional investments in prevention, which is really exciting. But at the end of the day, I think what we've seen play out in the national conversation was much like what we saw here in Massachusetts, which was a real commitment to focusing on coverage first, and I think a continued conversation about health spending and about healthcare quality. So, thank you.